How does PAE shorten recovery time for prostate patients? Have you ever wondered how some medical procedures can lead to quicker recoveries than others? Prostatic Artery Embolization, or PAE, is one such procedure that can significantly shorten recovery time for prostate patients, especially those dealing with benign prostatic hyperplasia, commonly known as BPH. Unlike traditional surgical methods, PAE is a minimally invasive approach. This means it doesn't requiring large incisions or extensive tissue disruption, which are often associated with longer recovery periods. During PAE, a healthcare provider inserts a thin catheter through a small incision, usually in the groin or wrist. This catheter delivers tiny particles that block blood flow to the enlarged prostate. As a result, the prostate shrinks, alleviating symptoms without the need for major surgery. This technique leads to less trauma to the body, which is a key reason why recovery times are shorter. One of the most significant advantages of PAE is that it is performed as an outpatient procedure. Patients typically spend only a few hours at the medical facility and can often return home the same day. This is a stark contrast to traditional surgeries, which often requiring longer hospital stays. After PAE, patients may experience mild discomfort, such as pelvic pain or burning during urination, but these symptoms usually resolve within a few days. Another factor contributing to the reduced recovery time is the lower risk of complications associated with PAE. Most side effects are mild and temporary, including some pelvic discomfort or urinary frequency. Serious complications are rare, and there is minimal risk to erectile function or sexual health, which can be a concern with more invasive procedures. Patients often notice improvements in urinary symptoms within just 10 to 14 days after the procedure. This rapid symptom relief is another reason why recovery feels quicker compared to traditional surgical methods, where patients may wait weeks or even months to see similar improvements. After PAE, patients are generally advised to avoid strenuous activities for just a few days. This allows them to return to their normal daily activities much sooner than they would after traditional surgeries, which often requiring several weeks of physical restrictions. In summary, PAE shortens recovery time for prostate patients by being a less invasive outpatient procedure that leads to fewer complications and quicker symptom relief. Most patients recover within 1 to 2 weeks, with some even returning to their usual activities the very next day. However, individual recovery times can vary based on overall health and the severity of symptoms. It is always best to follow the guidance of a healthcare provider for optimal recovery. While PAE is primarily used for BPH management, its advantages also highlight its relevance in broader prostate health discussions, including concerns about prostate cancer.